Welcome to Elevate, a podcast where we sit down with the women shaping workplace culture as some of the biggest names in the business. These are the leaders navigating change, putting people first, and keeping teams connected and engaged every single day. Elevate is brought to you by Line Zero, a global employee experience consultancy firm that partners with organizations to create connected workplaces. Tune in to learn how today's leaders are breaking barriers and building cultures where employees truly thrive.
Hello and welcome back to Elevate. I am your host, Joy, and I'm genuinely excited about today's guest. I am joined by Ashley Wenger, Senior Vice President of Employee Experience, Education, and Workforce Relations at Sanford Health, the largest rural health system in the United States. Ashley brings such an interesting blend of perspectives to this work. She started her career in labor and employment law and then made a purposeful shift into employee experience, culture, and workforce strategy. Today, she oversees employee engagement, internal communications, education, and workforce development, all with the goal of making sure Sanford's 50,000 team members feel supported, heard, and connected to the mission. Ashley, welcome to the podcast. I am so glad you're here with us.
Thank you, Joy. It's great to be here.
Amazing. All right. So I know that our audience are super excited to hear from you. So let's just dive right in. So Ashley, you've had a really interesting career path, from practicing employment law to leading employee experience at Sanford Health. What actually inspired you that transition? And what does your role look like today when it comes to shaping employee experience across such a large organization?
Well, when I started my career as a labor and employment lawyer, I did that for roughly 10 years. And although I really liked that work, what I found was I was often responding and cleaning up fires, things that didn't go well in the workplace. So responding to, say, a claim of discrimination or a policy that wasn't followed, or a poor leader that we had held on to for too long with an organization that was impacting other employees. And so when there was some opportunity to take a leadership role within HR, I found it as a really great opportunity to start shifting and being able to do some work more proactively, strategically thinking about how do we get in front of those problems that I was seeing from my labor and employment lawyer seat, and create a culture and develop leaders and put programs in place to avoid having those workplace issues in the first place. So that's really been the trajectory in which I've taken different roles within HR and been able to do that at Sanford, which has been great.
That's amazing. It's such a powerful shift. And, moving from a very reactive role to a role that is more proactive, I think that's very intentional, right? And that kind of leads nicely into how you think about employee experience more broadly. So one thing that comes up a lot when people talk about your work is listening, right? Sanford has made listening to employees a real priority in the recent years. How have you built that listening culture? And can you share, say, for example, an actual incident or an example of how employee feedback actually led to a meaningful change within the organization?
Love those questions, Joy. So yes, listening is really key to how we look at employee experience at Sanford. There was a time in Sanford's history, prior to me being here and the very beginning of my time at Sanford, when we had about a 10-year stretch where we weren't doing any surveying or other intentional listening of our employee population. And then roughly 6 years ago, there was a shift to adopt a platform and a real cadence and discipline around employee listening, and I have been privileged to be part of that. And I credit a lot of that to our current CEO's leadership. He has a background in HR, and I think came into the role really appreciating how important it was that we listen and know what's important to our employees. So we have adopted a platform called Pecan that allows us to survey our employees multiple times a year. And as part of that, I think it's not just the listening, but what we do with the action planning that's been really intentional. We have a lot of accountability for each of our leaders to meet with and discuss their results with their teams, and then engage their own teams in the action planning and deciding what are we going to do as a team to improve our peer relationships, if that's an indicated area for improvement, or how are we going to do better at create an environment where there's less of a power dynamic between employees. And so that's been a really effective tool for us, both at that team level all the way up to the organizational level, where our employees have continued to improve their engagement scores as well as their participation scores in the survey because they see the results and they see that we actually are taking their feedback and doing things with it. One quick example of that would be with our employee assistance program, which provides a lot of different services to employees, but one of the main utilized services is, free behavioral health visits for employees per incident. And so we were able to, in response to feedback from our employees, increase the number of free visits per incident from 3 to 6. With our research in that space has really shown most of your acute behavioral health issues can be resolved in 5. So really recognizing this is a need of our employees. We're continuing to hear what we're offering currently isn't quite enough, and then being able to meet that need. And there are a lot of examples like that, but that's one that comes top of mind.
That's really amazing. And I think that those are the moments when trust is really built, right? And I love how you close the loop there, like not just the listening part, but the action items after you have heard what the employee sentiments are. I love that. And what's interesting is all of that work is happening in a very unique context, right? Like a few years ago, healthcare had to rethink a lot of long held assumptions about work. Ford introduced a formal flexible work policy and even expanded flexibility into some clinical roles, which is super interesting, right? It isn't easy for sure in healthcare. And my question, I guess, is how did that shift come about and what impact has it had, especially in a rural setting, for example?
Yeah, COVID was certainly an interesting and challenging time for lots of different industries, but particularly within healthcare. Although we had many people we could not send home that were frontline caregivers, we sent a lot of our back office staff home in droves because it was the safest choice for our employees. Then, as we started to bring people back, I think it was really the first time as an organization that we thought about who actually has to be in the office and what does that need to look like. I think there were a lot of employees that enjoyed the additional flexibility that working from home gave them, and possibly a different schedule they were able to work during COVID. Some people, changed geographically locations where they lived. And so at that point, we really looked at developing what we didn't just call a work from home policy, but a working flexibly policy. And our reason for doing that is that we realized we have a huge portion of our population that are frontline caregivers that can't necessarily work remotely. There are some remote nursing jobs now as technology's developed, but that's not the lion's share of some of those roles. But we were able to put together a package for leaders and employees to consider if it made sense for them and their team that provided a whole array of different flexible arrangements they could consider. So really thinking about maybe I can't work remotely, but I could job share. Or maybe what works for me and my family is for me to work nights and weekends and to not work during the day because we're going to, avoid childcare expense. And so really providing a lot of different options so that every leader and employee has an opportunity to have a dialogue around what flexibility might look like for them and the particular challenges they're facing in their broader life beyond work at that moment.
I feel like that's really a very tough balance to strike. But again, based on the examples you gave, going back to the listening part and then taking action on what you've heard. So it's all about communication. You mentioned flexibility, right? So
Mhm.
flexibility plays directly into attracting and retention of talent, right? As we know, attracting and retaining talent is such a big challenge in healthcare. And in response to employee feedback, as you said, Sanford expanded benefits like paid caregiver leave. I read somewhere, fertility treatment coverage as well, which is really amazing. Why were those changes important? And what impact have you seen so far because of those changes that you've made?
I think the reason those changes are really important for Sanford is that we've been really intentional about getting to know the demographics of our particular employee population. And so being in the Midwest, largely having our particular employee population here for Sanford Health is largely female and largely, that childbearing age, which means when we think both age-wise and gender, that they're often facing many different challenges that include um, deciding to build a family, whatever that building that family looks like for them, and or taking care of an aging parent, or maybe both. And so those are some of the struggles that we really continued to hear when we listen to employees through a variety of different routes, whether it be surveying, rounding with staff, listening sessions, etc. And so we really felt like those benefits were responsive to those themes that we continued to hear from employees. And so some of those examples that you gave, we adopted a paid caregiver leave that we did not have previously, that could be used for either really any kind of family medical leave qualifying reason. So it could be aging parents, it could be a sick child, or the birth or adoption of a child. We adopted paid fertility benefits, and so there's a portion of funds that are available for staff that want to build their family that way, as well as for adoption. And then we also made another similar change I'd put in that bucket, related to expanding our compassionate leave policy to cover those that undergo a miscarriage, because that was another example we had, that there's no coverage for someone that goes through that experience. And so I think those are some really great benefits we've been able to build out to be really responsive, again, to the unique demographics of our employee population.
I love that. Like knowing your demographic, knowing what they need. I can only imagine how all those changes you've made had resonated so much and so deeply with the workforce. Like, yeah, I can only imagine. Like all of those things that you're doing is very personal. Like not one size fits all. It's like specifically for the people who's working for the organization. I love that. Now, one good thing that I feel comes out of that is typically when employees feel supported, they're also more likely to speak up as well, right? Psychological safety is another area you focus on. How do you create an environment where everyone from frontline staff to leaders, they all feel safe to speak up and share concerns? And what role do programs like I read Safe Rounding and also some leadership training, how does those play in that? Can you tell us more about these programs as well?
It's so important to work on building psychological safety, and we certainly haven't arrived in that space. I think it's one of those that you're always trying to do better, and we probably won't ever arrive. But we have been really intentional on trying to build out language and skill sets, both in our frontline staff and our leadership, around psychological safety and how you build psychological safety on your team. One of the mechanisms that you mentioned is we are a high reliability organization through a program that we call, our internal program is called SAFE. And that really started, I would say, on the premise of patient safety and avoiding harm to patients and speaking up for safety. But we have built that out using the relationship skills in that HRO program to really talk about that psychological safety that we create for each other, where everyone feels like they have the ability to speak up, and that their coworkers and those above them in their hierarchy value their opinion, and that they feel safe to bring up and share feedback. And so that really has been an evolution for us to build that out beyond just the patient safety realm over the last couple of years.
I agree with you. That's not an easy work. It's always ongoing. You can get there or maybe you won't get there, but the process is it's the process really that really I think counts for the employees. It's the effort of the organization trying to meet on a level where, there's kind of, I wouldn't say compromise, but an understanding, I would say, right? Now, I'm so happy when I heard about this. Sanford was recently awarded the Platinum Bell Seal for Workplace Mental Health, which recognizes your commitment to a mentally healthy workplace. What steps have made that biggest difference, and what can employee experience and internal comms leaders in other organizations learn from your approach?
Well, we're very proud and excited to have that recognition, but I think it's continually focusing on, again, what we hear are the needs of our employees. I feel like beyond the walls of our workforce, we know that behavioral health, mental health is in high demand, particularly post-COVID years. And we're seeing that in our employees' children, all up through our employees and their families, and wanting to provide better services for them. So one of the ways I would say is that, the building out of more robust employee assistance program resources that I mentioned earlier, and providing additional sessions there. Another is that we have really championed to have all of our leaders be required to participate in a program that internal program that was built by some of our clinicians called Be Heard, which is really equipping leaders with what I would call behavioral health first aid to be able to recognize and then, you know, I would say connect their employees with the right resources. We don't expect our leaders to be able to triage or handle or be counselors if they see someone in need with whether it be, suicidal thoughts or possibly addiction or other things they're struggling with. But we do want our leaders to feel like they have the skills to recognize an employee in need and then connect them to the right resources in the community or within Sanford. And so that's something we've really prioritized the last couple of years is making sure all of our leaders have that training and are able to be that connection person for our staff.
Right. So they don't necessarily have to have the answers, but they are becoming the connectors. Can you cite some example? I love that we heard. I know that our audience will be interested to like if you can cite some examples of what happened on those campaign.
There are really powerful examples, I would say, of where you either are able to, in a one-on-one meeting with an employee, where we've been able to identify that there's a need and connect them with resources, or where we have even had folks that have used that in their personal life, right? They've gone home and they have a teenager that's struggling, and they didn't realize it until they took the course that they weren't asking quite the right question, or didn't have the confidence to step in and ask the hard question about like, are you considering hurting yourself? I mean, do you need to, I'm going to stay here with you and connect you to resources before I send you home for the day. And I think equipping leaders with what to do next so that whether they're at home in a personal conversation or in a huddle at work and they realize they have someone in need, they know what to do next. And then I think it's really just that muscle memory and confidence to take the step that we're sometimes nervous about whether we're going to say or do the right thing.
Right. That's just incredibly human, well-being, belonging, support in workforce. They're all kind of deeply connected within each other. Now, your engagement surveys shows improvement in inclusiveness and employee feeling their work is meaningful. How do you help ensure people feel a sense of belonging and purpose across such a diverse and distributed workforce, especially now that you have all those programs in place that made the whole team kind of distributed and flexible in terms of where they work?
We're really excited to see continued, high scores in our area of meaningful work on our engagement survey at Sanford. I think the key to that has been one, what our mission of the organization is incredibly powerful. So, we are caring for patients, residents, and members at their greatest time of need. And that is, by definition, super powerful and the reason many people go into healthcare. But to your point, we have a lot of diverse workforce, a lot, back end office folks that are maybe in rev cycle or IT or HR that support all of the hospital work. And they're definitely not touching a patient. But I think what's been really critical is that we've been intentional with all of our communications and a lot of our internal messaging at Sanford to talk about how everybody is a caregiver and to really tell those stories of how somebody speaking up for safety in IT can have an impact that then, touches a patient. Same thing for finance or HR, really letting everybody see the impact that their work is having on the broader mission of patient care is how we've been able to have that success and then sustain it, Joy.
That's such a powerful way to frame individual members of the team's purpose, right? Like
Right.
acknowledging that your work matters. Like it's not directly related to healthcare, but the work that you do matters. And I think a lot of leaders needed to hear that too. So that's a very good reminder. Thanks for sharing that, Ashley. None of this work without strong communication systems for sure behind it. So I'm curious, and I know our listeners would be too, with roughly the size of the organization you're in, which is 50,000, is that right? 50,000 over?
Almost 55,000 employees now.
Right? So,
Yeah.
and you're across many different states. What is an effective internal communication tool or platform that you use to keep people connected and informed? And what do you look for when you're evaluating an employee experience or internal communications technology?
Well, I would say there's no one platform that you can rely on. I think what's really important with communication is meeting every employee where they're at. especially given the diversity, both geographically and role wise for our organization. And so we've really thought about it as, again, like a communication ecosystem. We have to have multiple different channels in place and be actively both listening and responding in all those channels. And so a few of the things we do at Sanford, we do the surveying that I talked about before, both a full employee engagement survey and a pulse survey every year. We do onboarding and exit surveys with our staff as well. But then we also are active in terms of we have an employee intranet for our employees that are at a desk more that they use. We utilize email, text message. We also rely on our leaders to cascade messages and really equipping our leaders with the skills and FAQs and toolkits to be able to carry a message forward to their teams and their standing team meetings. And then again, we lean into our HRO programs that we talked about before, which really emphasizes rounding with employees as well as daily huddles at the beginning of every shift. When I think about those clinical settings, that is often where leaders are carrying those key messages out to staff before they start their shift every day. So it's a variety of things, no one size fits all. But together it creates effective communication.
That's amazing. Communication ecosystem. That's what you mentioned. I love that framing. Like there's no one specific platform that will solve all your needs per se, but more like depending on again demographic, right? What works for your people. I think that's super powerful. Now, when you say that you're having leaders cascade the messages, and I've been hearing this, so I'm curious to see if it also is the same for your organization. But I've been hearing that managers, like those directly reports, they trust their managers more than those that are in the executive team, say, for example. So, does that work for an organization like Sanford as well? Like, who's the information coming from? Like, what information should come from leadership? What information should come from like managers?
It's a great question. I think it depends on what you're trying to communicate. I do agree with you. I think that immediate leader is the most trusted individual. Having a trusted, strong relationship with your immediate leader is what research shows us is the most likely factor someone to like, stay or go from their job, right? And so that's a really important relationship. And I think the importance of communicating key messages through them cannot be lost. But I do think that upper level leadership or a skip level leader being the one to communicate recognition can be super powerful, because I think when it's providing an award or coming down to celebrate a success on a team, I think that carries then like an outsized weight with those employees, right? Because not only is my leader proud of me, but they actually are telling my boss or their boss's boss about the great work.
Mhm. That's a very intentional kind of like choosing who the messaging will come from. And I agree, whenever it's more like higher up and recognizing you, it carries a bit more weight for sure. Also, another thing I want, like personally, I wanted to share that I've been hearing from our clients too is depending again, demographic. Sometimes one size doesn't fit all. Like there are some employees who'd like to be recognized on a bigger scale, but there are also some employees feel shy and just appreciate a one-on-one. So maybe that's another thing that we can share to our listeners today.
Absolutely. Recognition is very personal, right? And some people might love that you call the whole team together and call them up front, and there's lots of fanfare. And other people would just run away terrified if that was the idea, right? Like, I'm calling in sick today. I don't want that, even if they're being honored. And so it's really important to know that about your employees. And actually, something at Sanford we just started probably 6 months ago now. But when we have a new employee start, our we have Workday as our main system to house employee information. It kicks off a recognition questionnaire to employees. So each leader gets to know that individual's preferences and how they want to be recognized. What's more meaningful to you? To get a gift card, a note, a shout out in a meeting. And so you have an opportunity to have that dialogue with your employee and know individual preferences and do something that's more meaningful and more personal for folks.
I love that. It's not just communication, but also the culture piece. So it's building the entire culture already. I love it. All right. So, as our audience know, this podcast is all about elevating women employee experience and internal comms leadership. And as a woman at the executive level already, what lessons or challenges have shaped your leadership journey? And what advice would you give to women aspiring to lead in this space? Sorry, that's a hard shift, but I wanted to talk a bit more of an advice from you.
Yeah. think lessons and advice often bleed into the same thing. I think one of the biggest lessons I've learned is that you kind of get to pick the best of the other leaders you've experienced in your life or observed, or maybe had as mentors, and pick and choose what you want to be like, that you don't need to necessarily emulate the characteristics of your boss or those, maybe the person that was in your role before you, or maybe a male colleague that it looks different with, that you get to pick and choose what your leadership style is. I also really feel like one thing that's been really powerful that I would, encourage other women to do is I came into this role, my first executive role at Sanford. I was pregnant with my third child, and I have four boys, fairly young boys still. And so I like both have to integrate work and life a lot. And so I think my staff members seeing me do that, being publicly sharing, I'm going to be off for 2 hours this morning because I have to catch a child's play or a well child appointment. And then, I've got a sick kid, so I'm baby wearing on this conference call, and we're just going to all, give 30 seconds to how cute the baby is and then move on with the rest of our work. Like it's just normal. And normalizing that for people, I think allows and gives permission to other younger women to say, I can still do this and I can do both. It might look different. It may be complicated at times, but there are people modeling that as something that's accepted and celebrated within the organization. So that would be my encouragement to others.
Authenticity. That's the first. As you're speaking, I was like, she's so authentic. Like you are uniquely you, right? You don't have to fit in someone else's box. You can build whatever shape of box you want as a leader. And organizations mature, as the industries mature, as the world completely changed, things that are, I didn't imagine the world being like this years and years ago, like people just talking over screens. Who would have thought, right? So then you can just be uniquely you and your circumstance. Another term I hear right now is work and life harmony. So it doesn't have to always be balanced, but we have to find a nice harmony at least. And four boys, wow. I only have one girl and I'm struggling.
Yeah, I definitely think work-life balance is a bit of a misnomer, right? Like it never feels real balanced on any given day. But one of my early mentors told me that it's not about if it's balanced over a day or a week or even a month, but if you look back on a year or you look back on a decade and you feel like my life is balanced and I feel good about what I've given where, that's more of like what the balance is. And so I think I've tried to keep that in mind when I feel like things are a little imbalanced in a moment.
I really appreciate you sharing that, Ashley. For sure, that's going to resonate with a lot of our listeners. So I want to zoom out a bit as we wrap up. Looking ahead, so just to showcase your thought leadership, what trends or changes do you see coming for employee experience and internal communications, especially in healthcare? And how are you preparing for what's next?
Great question. Two things come to mind for me in particular within my role at Sanford. One would be within healthcare, we have this sort of demographic cliff coming in terms of workforce pipeline. We have, especially in the Midwest, a real shortage of both physicians and nurses, and we're very cognizant of that we need to increase class size and our universities we partner with and build up, I guess, excitement, engagement with healthcare careers in our K through 12 programming. And so I think that's all great. I think, but what part of that shift is going to be for us is really focusing on creating that great experience and retaining the staff we have, because we know that we don't have a plethora of other candidates out there to fill these very important caregiver roles. And so it's going to be more important than ever that we're retaining our top talent at Sanford. So that's one thing. Another top focus for us, I think, and everybody, if you go to any HR podcast or seminar, you're going to hear about AI, right? And so I think particularly within my role, not focus so much, maybe a bit of a different perspective on it, but really how do I help educate and equip all of our employees at Sanford to utilize AI in a safe way, and in a way that they don't get left behind and that they can do their job better. And they really see it as an accelerant for what we're already doing, and amplifying the work they're doing as opposed to a threat to them or their career choice. And so I think really trying to get staff excited and engaged in learning about that early, and how to utilize it as a tool has been a focus for us at Sanford.
Amazing. retention and AI, like being up to speed and safe use of it. Amazing. That's very powerful. Yeah. It's coming. It's coming for sure. All right, Ashley, this has been such a thoughtful and very energizing conversation. Would there be any other final thoughts that you'd like to share that we have not covered in our questions earlier?
Just really appreciate the invitation to talk with you. And no, I think you've covered it well. Thank you, Joy.
Amazing. Thank you so much, Ashley, for sharing your insights and for inspiring us all with your work. And to our listeners, thank you for tuning in to Elevate. If today's conversation sparked ideas about improving your own organization, we want to help you take the next step. At Line Zero, we offer personalized employee experience assessment. Our consultant will spend time with you to evaluate your unique employee experience ecosystem and understand the specific challenges you face in engaging and also supporting your workforce. You can learn more by visiting us at linezero.com. The link to our page is on the description. We also encourage you, of course, to follow Ashley Wenger on LinkedIn to see more of her amazing work at Sanford Health. And finally, of course, if you enjoyed this episode, be sure to follow us on Spotify, Apple Podcasts, YouTube, and LinkedIn at Line Zero for more conversations, insights, and stories about internal communications and also employee experience. Until then, keep elevating, keep inspiring, and let's make every workplace a place where people thrive. Thank you, everyone.